is have it. Don't leave it at home. Don't leave it in the car. It needs to be on your person, in your handbag, because you will bleed too quickly. It's no time to go and get it. Okay. Make sure it's also nice and neat and not like this, like your shoelaces. Okay. So I'm going to show you. Oh yeah, absolutely. I'm going to treat the medic. Okay. So I'm going to show you on James, and I'll show you on myself, because you can also treat yourself.
Sounds nice.
Treat yourself. Okay, so if James comes up to me and I see he has a wound to his arm and the blood is leaving the body quick, okay, first of all, I will open the tourniquet up and put it here. First thing, if I can, I go to skin, if I can, and do tight to begin with, all right? Then you start to turn, 1, 2, I do it now because I don't want to hurt him. In reality, until the tap is off, until there's no more bleeding or a little bit, it's going to hurt him. You just have to say, it's okay, man, I'm doing this for you. It's going to be okay. He will try to push you away. This is more painful than this. So you need to understand this. If it's on the leg, so I see a big wound here or here, we put the tourniquet on the same way, but with a large muscle like this, you might need 1, 2. Try 1. If it doesn't work, add a second one. All right. Just avoid the knee and the elbow. So if the injury's here, don't put here. Go even higher. If there's any danger, just go high. And if you have to, even over the clothes, just to get out and keep the patient alive. Okay. The softy is slightly different. So what this one is same thing. Always hold the windlass. It's a good anchor, and tighten. This is the important bit. Turn, 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 lock it off, and then for security, you put the triangle over. You'll all have a go. All right, I'm just showing you. This is now on, and he will be in pain. Once you've put it on, leave it on. Let another medic or someone more experienced in medicine have a look. If you take it off and he's still bleeding, you're back to the beginning. Does that, everyone understand, yeah? Mm-hmm. Okay. Just very quickly, I'll show you, put on myself, and then we'll pass them round for you to have a look.
I have a question.
Please.
If we have these parts injured, what should we do? Like here or here?
No, so the tourniquet, the tourniquet is turn off the tap. Mm-hmm. So if the wound here, the tourniquet always has to go above, closer to the heart. If the injury is here, this is the part where I said, Callum will show you, you just need to put bandage and gauze inside. This will not work for a tourniquet, like the neck and like the groin. It's too high. We have to squeeze the arm. That's why this works. All right. So the same thing. I'm in a situation. I'm injured. Luckily, it's my left arm because my tourniquet is on the right. Okay. I open it up and I'm in. Okay. All I do.
Wow, that's fast.
And I'm on. Bang. And then I'm on. Yes, I can do this and this and this, but I'm alive at least. Okay. It's easier if it's on the leg because I have both my hands. On one arm, problematic because this arm might be missing. Are we happy so far? Shall we pass them around? Any questions? The principle is clear, yeah?
Can you please repeat this last one, but slow?
Okay, so.
Yes,
yeah, no worries.
You'll be famous.
Oh, just make me look taller.
Yeah, so pull
You
the
look
plastic
great.
off.
Yeah.
If you buy your own one, then take it out of the plastic. Keep it in your bag.
I'm in this situation, I injure my arm. Take it out and open it as much as you can. Over. And I'm on. Now I just need to turn, turn, and turn until the bleeding stops.
It's easier to do on someone else. So for the moment, if you're up with someone else.
With my leg, it's easy because I have both my hands.
Yeah, 2 hands.
Yeah.
Great, thank you.
You want to have a look at this one?
Probably do it to each other. It's very hard to do.
Please.
Do you know there's types of tourniquets we have?
Yes and no. this one, right, your root will make a ligature.
This is too small.
But that's okay, because then you're going to get it when you twist. Okay. Should it be like this? Yeah. But I can feel your pulse, so you need to tie it up. But but in reality, tied up. Okay?
To keep it, because with nothing else, you use it.
But in case of any critical situation, how do we use this?
So you can do it two ways. You can literally just keep pulling and tightening, and then you just need to just tie it off, or you might just have to hold it. All right. Or you can get a windlass, so find something strong. The problem is this material doesn't twist so well.
Yeah.
Another problem, like you can't
So
use
I can't use my hand, you know, like nothing.
It's very difficult. This, look, when you twist this, it's not this that turns. It pulls nylon inside. Try to do that with this, you have a problem. All right. So you.
Sometimes, when you use an improvised tourniquet, you don't stop the arterial blood, you stop the venous flow, so you can make the bleeding worse. I'm trying to think of an example. So if I pull that tight now, so if you see how my veins are like that, if I do this and don't stop the arterial blood, actually, I stop blood coming back and even more blood comes out. I'm actually making it more hard for my blood to return to my body. So actually you could make bleeding worse if you only do this half. You really have to, if you're going to do it rapid twist and rapid twist. Until you can't feel you've got to stop the pulse, really.
So basically for me it's impossible.
Well, try, see if you can stop my pulse with it. Have a go. Well, you see if you can stop my pulse with it.
Go on, ready?
Yeah.
Because I need to imply significant force.
Oh, okay. That might be it. Yeah.
So it works, but now how do you hold that? It's
Yeah.
problematic. But you'll get the ligature effect. So only in an emergency. My best advice, buy one of these or get a donation. Guys, can I just say one thing, everybody? That I forgot to mention. Guys, listen up. Guys, listen, because it's important. Listen. All right, guys, these do come apart, but it's more time. The only time you really need to do that if the foot is trapped, because you can't go over, so you go round. In a situation where the foot is loose, keep it like this, and for speed, just go over the foot or over the arm. You don't need to undo it. It's too slow unless they're trapped. All right, play around for a little bit more and then we'll give you some scenarios. Okay. So do it on me and don't be afraid. I have two arms, I can lose one.
Okay.
So hold this, hold that, hold it tight. Okay, good, now we got that, now start to turn. Okay, good, keep going.
One more?
One more, just go for crazy. Okay, lock it off. Use two hands now. Yeah, two hands.
Now.
Okay, lock it off. Now put the triangle on.
Here?
Yeah, no, over the edge.
Edge. Okay.
Like this.
Yeah. Okay.
Okay, yeah. Once in real life, never take it off. Once it's on, it's on. You understand?
Then how can I...
So the doctor will take it off. This is the good thing about the tourniquet, you never have to know it.
Yeah. Okay.
Yeah, the doctor will take it off.
Thank you very much.
Yeah, quite ready, aren't we? Who thinks they're feeling quite confident? Who thinks they're quite good at putting them on? Any volunteers that think they're quite good?
Just while we're waiting, whoever's put one on quite tight, especially if you put one on me or you put one on Callum, I promise you in real life, you need to do one or two more turns. It's going to be so painful for the patient, but you have to do it, because if you only do it this tight in real life, like you did on me, it won't work. It's tight, and one more when you think.
I have a question. How long you can keep it so tight on the arm?
Minimum 2 hours. Plus.
Is there anybody that doesn't want to get dirty?
Anyone happy to get covered in blood?
And here
Fake.
we mark, right? The time.
Time, if you can remember.
Yeah.
It washes out.
Yeah? Ready? It's wash, one wash, no problem.
but you can avoid it.
This is problematic.
No, with a
Ready? Come, let's go. Go, go. Quick, we've got to bleed. Let's go. Come on. Get away. Come on, quick. Come on. He's your friend. Let's treat him. Come on. He's taking the long way. Okay, now you've got to jump in. Let's go. Come on, guys. You can bleed out in 3 minutes. 3 minutes. Good. Excellent. Get it on. Come on. Do it up. Pull it tight. Good. Excellent. Now start to turn. Already 1 litre. 1 litre. Not good. Go. Turn, turn, turn. Okay, lock it off. Okay, bleeding stopped. Happy days. Okay, let's get off. You see, it has to happen quick. Yeah, let's not kill James. Yeah. So you understand, it has to go on quick, it has to go on fast, and you have to be like him, very confident and aggressive. So well done. Well done, my friend. Okay. If he's in pain, it's a good sign on this exercise. Who's next?
He's brave enough.
Who's going to go? What's going to happen when he falls down this side?
Yeah. And look, not a drop of blood.
Yeah, clean.
Example. Ready? 3, 2, 1. Okay, come on quickly. That's it. Over the wound, higher. Good. Let's go. Pull it tight. Excellent. Perfect. Now start to turn it. Turn. Yeah, with 2 hands. Yes. Now you stop the bleed. All over, no notepad. Okay, can I turn it more? Okay, keep going. Okay, perfect. Now lock it off. You have to lock it off. Yes, you have to be strong. Good. Okay. Now, if you have this, what do you think you can use? Another one, right? Another tourniquet.
Yeah.
But this is okay.
One more?
Yeah.
I feel like. That's if you like.
Oh dear. Who's
Usually do we see where it started bleeding? Like, because he's lasting.
So just go high and over the clothes. If you have time, direct pressure and cut the clothes. In the danger, just go high.
Sometimes they recommend to apply tourniquets somewhere in the groin area. Here, is it correct?
High and tight. Just as high as you can because everything will stop. You don't need to see where the bleed is unless it's here, in which case you need to do packing. How did we start?
So there is a problem when people start bleeding, that they might get a little bit agitated, and they might become angry and try and fight you off, and it hurts. So we'll do another one in a minute with that. But Joel's just going to go through. So if you're asking, if you don't have a tourniquet, what can you do?
Guys, come round.
So there's a way to improvise one.
Okay, so a lot of people won't have this cat tourniquet. Who had the other one, the plastic one? You had an improvised. It's very difficult to find a tourniquet that works, that isn't like what we call manufactured, specific. But what you can use is a broad fold triangular bandage. Most of first aid kits in a car, in an office, they will have this. All right. So broad fold, 1, 2, because the tourniquet needs to be wide, not short like this plastic. Okay. Let me borrow your arm a second. No, your arm. Okay. So you go round and round again. Has to be round twice. If I do just once, when I start to turn it, it puts direct pressure. I don't want direct pressure. I want to turn off the tap. So you go round and round again and tie it off. Okay, 1 tie. Maybe something strong. These are perfect. On, tie off. Okay, remember the wound's here. Wherever the wound, I go above. It's not a bandage, it's a tourniquet. Start to turn, you'll feel it. I won't do it too tight, okay? 1, and then you're here. You feel it? All the way round. And eventually, it will turn off the bleed. You just have to find a way to stop it. You understand what I mean? So this is a good way. Most people in the first aid kit will have the triangular bandage and this. But this is always the best. Are we happy?
Yes.
Cool. All right, over to you, Callum.
Right, so as I say, so when your brain doesn't get enough blood and oxygen, then you often become quite fighty and quite combative. So when you're doing this and using a tourniquet, you need to, as hard as it is, keep saying, you know, you're going to be okay, or keep telling the person they're going to be okay. You're trying to help them, because they may try and fight you off, and especially when these get put on, if the person's conscious, this often, as we've said, hurts as much as the actual injury. So they will try and take it off. So you've got to try and reason with them, okay? And to put that into practice, somebody gets to fight with an agitated man. So,
What's gone wrong? He's back to life!
Help! Help! So they're gonna fight him off. He's gonna fight you off. So you gotta get through it.
You might have to do this, Callum, just hold it on.
Hold it what?
Hold that one.
Yeah. Ready?
Yeah.
Help! 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 Ah! Ah! No! No! No!
I'm gonna
No!
help. I'm gonna help. I'm gonna help.
No!
I'm gonna help you, man. I'm gonna help.
No!
Let me help you. Let me help you.
No! You can help him. Someone can help him. You might need more than one person.
Put it down. So you have to push it down. Alright. It doesn't work, it's locked in anyway. Okay, fine. So now you need to get him on his back and move him off the step. So we'll do that together. Okay, ready? Move him on his back. Oh, look this way. Move him on his back. And now you have to manage his airway, which you'll learn on other stations. Okay? That was the worst lift ever. Okay?
Fine, fine. So,
Well done, mate. God knows what happened there.
so they can get quite angry, and it can be quite hard to control them. Okay, but this is what they look like when you've not got enough, when you're losing a lot of blood. So it can be difficult. So good stuff. So what we'll do now, if we come to the table, is we'll go through bandages and packing into wounds. Okay. And then we'll come back onto tourniquets. So this is for the areas that you can't tourniquet, so in your arms and your groin and your neck and that kind of thing. This can be for anything, so like a big knife kind of slash wound there, a gunshot wound, another gunshot wound, and then big kind of blast wounds and shrapnel wounds like this, okay? So the important part with these is to find where the bleeding's coming from, okay? So what will happen is you'll kind of need to look through the blood and move some blood, find where the blood is, and then you need to get pressure onto that point, okay? So to do that, you use bandages. So you can use any kind of bandage from first aid kit or anything. There is a special type of bandage which helps the blood to clot, okay? So this one actually helps the blood to clot. So this is the best one if you have it. But if you don't have it, then any kind of bandage is okay. So what you need to do is get right into the point, okay? So you need your fingers. So people think when they put pressure on, to put pressure like this, okay? One finger is often better than a whole hand, okay? So you put it in, and then you feed it through so that your finger is pushing down onto where the bleed is coming from, okay? And then you have to fill the whole hole, alright? So this big hole needs to be filled up, finger with the other. Now when you fill the hole, you then need to push down and hold for 2 to 3 minutes at least, okay? Keep pressure on so that the blood underneath will form a clot, alright? Then after that, if you have a pressure dressing, these are the best. But any kind of bandage will do. put this little plastic cup that applies extra pressure onto the wound. So you put that over, and then you just press around and put bandage on. But if you don't have one of these, then one of these is okay, whatever you have to use, okay? So if there's bleeding from anywhere that's not like that, gushing all over the place, okay, and it's just kind of trickling, then you can just use a bandage, okay? If it's constantly bleeding and oozing and there's a big hole, that's when you're going to pack it, all right? But this is also painful, so people will be in pain when you do this. You can also pack, legs, so if you put a tourniquet on, you could then do this as well, all right? And the bum as well, okay? So you can pack into people's bum. That's probably most of it. So again, we've got some gloves. If you want to put gloves on, if you don't want to get dirty hands,
because it really helps.
I have a question.
Yeah.
For example, I have multiple, such injuries, like throughout all the legs, for example.
Yep.
Should they apply?
Yeah. If you've got like a limb that's blown off, or 3 or 4 gunshot wounds to one leg, or something like that, if it's bleeding heavily, then you can apply a tourniquet. Often, what might happen, especially if it's something like a knife, often you might have lots of wounds, but only one will be bad. So you just look at the one that's bleeding the most and deal with that first, and then deal with the others. But yeah, if you've got multiple wounds from gunshots, you can get a tourniquet on high, nice and early above everything. Then later on, you can look and see if it needs to change. Okay. But yeah, so there's quite a few of you, so we'll try and get through everyone. But we've got 3 different wound things. So what we'll do is put some gloves on, come across, and other people can watch and have a look, and we'll have some practice on packing some wounds.
Take your bandage. Okay, so let me fill it up first. So you come to the patient, and the wound looks like that. So you have to go.
So just normal bandage like this?
Just them, yeah.
Ready? Go.
Okay, who wants to go on this one? Who's got gloves on? Do you want to put gloves on? Or you're okay? Well, it doesn't matter.
Go down into the wound. Good.
Someone can go on this one as well.
Okay.
Yeah. Oh yeah, of course, yeah.
Yeah, here, really good. Digit, find the bleed. Push more. Exactly, good.
So, get ready. So it's going to be in here. And you see it's starting to bleed. Bleeding up, there it goes, everywhere.
It will be 3 minutes.
So
Okay?
get in there, stop the bleeding.
So let's imagine 2.5
Pushing and
pushes,
pushing
3
and pushing
minutes. Now
until
what
it's
you can do.
bleeding. Okay?
Yeah, good.
Get in there, that's it.
Yes, put it
Perfect.
on top.
Keep pushing it in.
Exactly. Lift it up.
Keep pushing. Keep pushing it till it fills up or the bleeding stops. This one's about to start bleeding.
Yeah, excellent.
There it is. Get in there quickly.
Pressure on. So it does this
Keep
for
pushing,
you.
and then push hard.
You can get a colleague to hold that if you want. I can hold that bit. I'll feed and you push.
Okay, so then you hold that on. So we say it's been a couple of minutes, and then you can put bandage on. Okay.
And let go.
So this is a bit of a different one. This is
Yeah, as soon as it stops, we obviously keep pressure on afterwards. But yeah, as soon as you feel it's full, and you can cut that and then start working on that
t-shirt.
quality.
Yeah, that's fine. Yeah, t-shirt, jumper, anything.
Okay, so we put this like a
That's
pressure.
Yeah, like pressure, and then over, and then get them and under their arm.
Ready? So the, oops, sorry. Okay, so wait a second. Hold on, hang on. You ready? How does this bleed for? Right, let's go.
So then you hold pressure, and then you can put bandage on over the top of that.
Shall we put something like
Inside the wound. This could be on my arm, this could be in my arm.
plastic cup?
More.
So if
Can you
you've got,
substitute that plastic with something else? And
you could try to,
I put it like
but
that?
it will do the same job.
No,
So it will still be okay.
other way around, yeah, like this.
So what I do is put your,
I mean, that's
finger on.
this is not an easy one to do.
And
You
then
put
go
that on
over.
there, and then sequentially, yeah, I mean, you
and then
can
over, so you
practice my arm if you want. But yeah, that
It's going to be like,
would go on. So you start to go around, and that just puts a bit of pressure on you.
together with your fingers.
Yes.
starting from the wrong direction, right?
No, it doesn't matter. So then that just clicks like that, yeah, and it stays in. But you could use
3 minutes. Now put that on. Go.
hairpin
This is the
or
bandage. So
anything
you can
to
take this off
tape
now.
whatever you've got.
Okay.
Okay.
Cool.
Understood.
Yeah. Good. So this puts the pressure on there. You see the cup puts the pressure on. Good.
Oh, nice work.
Well done. Lifesaver. Alright, yeah. Cool, who else wants to go? It's really good to practice because it's unusual skill. Very unusual skill, obviously.
The other thing is that we were going to say whilst we're standing around is so this is like we said for into your arms and your groins and your neck, not for your chest or your tummy. Okay, so don't do it into chest or tummy because it won't work very well. So for chest and tummy, chest you'll do out there for like if there's a breathing problem. For your tummy, if it's bleeding, you just have to put pressure on. Okay, and then the last group, they asked about like what happens if there's like bowels and intestines hanging out and that kind of thing. So don't put them back in. Okay, just leave them. But you can get you know, like household glad wrap from your house, that kind of stuff, and just put it around them like that. Okay.
Don't try to push them inside.
So you just hold them in with glad wrap, and then, or like this bandage, if you've got a really big bandage that has a big pad, okay, so you can put that on like that and then bandage around. No, not anymore.
Okay.
I don't bother. I mean, yeah, I don't think it's, either way, doesn't matter.
And then, so just demo how to get the bandage under the armpit and the neck. Also, if Callum was injured here and we did this inside here, the best way to put the bandage is under the armpit and round the neck. Or if the injury is here, you put the bandage here and you secure here. Never round the neck or never round the chest, okay? Okay. Diagonal.
If they're very conscious and stuff as well, you can get them to hold pressure themselves and that kind of thing. Cool. Who's going to go? Anyone going to go again? Anyone want to?
Come on, someone new. Let's go.
Like the bed cut, same as the same.
Same, but so the only difference is, so you would pack in like you would normally, okay? So the only difference is you need to find where it is. So it could be here, it could be here, the bleeding. So find the bleeding, and then pack into the bleeding part.
How big is this guy?
And then you're kind of just going to try and hold the rest together.
His back, leg, arm,
Yeah, so you fill it as much as possible, but you won't fill the whole thing. So just as much as possible.
3 minutes with your finger, then the bandage. By this point, it should already be working.
Bandage. Do you want gloves or are you okay?
Okay, happy? Ready? Wait for me. Hold on. So I tell you when. When I say go, wait, ready, go. Okay, start packing the way. Good. Push down with the finger. Keep the pressure all the time. Good. More. So try to keep always the finger. You need to keep the pressure. Good. Yes.
Okay, it's coming. That's it.
Is it difficult to wash out? Is it fake blood?
Do you think you're enough?
No, it's just one wash in the washing machine. It's not, it's washing machine, one wash. That might take a few minutes.
One washing machine, yeah,
Fill it
for your
up
hands.
as possible. So yeah, that's good. And then just hold for so yeah, as much pressure as possible. 2 or 3 minutes.
Can you add some 1 minute?
Yes, of course, yeah.
2 minutes.
Let me,
3 minutes.
are you going to do this one or this one or this one? This one. I think I would work.
Then yeah, so say it's been 3 minutes now.
If I could see a very defined bleeding point, I would go for that.
And then you do that.
Generally, you're probably going to
Pressure
have
on.
to go like that. But see where you can see the bleeding point first. Where it's
Если не можешь
So keep the pressure on.
найти, надо откуда течет кровь. А если не находишь, то вот так вот, ну, пока засовываешь чисто. Сидни, вот Сидни в такое дело засовывали.
if this person was unconscious, it's easy. But if they're awake, it's very hard because that will hurt when you do that.
All right, everyone happy with the wound
So
packing?
let's see if you can see. Have a look and see. Can you see anything? And start packing. Maybe get someone to feed for you. I think if there's 2 people, someone will hold that. Someone will hold it and feed it, and they go. Ready? Go.
Whatever one, if they're both bleeding, do both. Sometimes one will be bleeding heavily and one won't be, so just go for the one that's bleeding heavily. But whatever one's got more blood coming out of it, go for that first.
Хорош.
And if you're not, what other
try and,
if you're not sure and it's bleeding
rather
a
than
lot,
going
what do we go back to?
1, then 2, then 3. So feet press all the time. Press all. Try and be pressing down, and you're trying to keep the pressure. You know, as you're feeding in, try and keep pressing
If
all
you've got
down.
an arm over there and a leg over there, and you've got 2 things,
No arm and leg bleeding, like to put here and then here.
leg will bleed quicker, so you'll bleed quicker out of your
I think
femoral artery.
if no arm, so arm.
So then you might need a second bandage and keep going and going and going, isn't it? And then once you've filled that and you've seen the bleeding stop, keep pressing. And I would go for one of those.
That may bleed over the top. But whatever one's bleeding more, go to that first.
No, actually, this one's the last one. Yeah, you need one of these sort of ones like this, yeah.
Make your way through. Sometimes you just can't be everywhere, right? So if there's someone that's got 20 injuries and you're the only person there to help them, not much you can do. You can only do what you can do.
Then, obviously, if it's a proper limb, you can get under it, can't you? But you would then be circumferentially wrapping it.
Is there any questions about anything? Does anyone want to try? Has everyone tried?
Ну, ты подержишь? Да.
If you can, I would definitely practice putting the tourniquets on. That's the thing that's going to give you a big dividends.
That's a good idea. Let's do some more
Yeah, so if I were you, I would get a tourniquet, practice putting on another person, practice putting on yourself. That would be really, that's the one that's going to make a big difference, I think.
Well and truly.
Again, if you can get on yourselves.
I have already tried.
You've done you.
Yeah, I'm done.
Yeah, several times.
Yeah.
You can have it, huh? Okay.
This one, yeah. Got bandage. You're gonna help, yeah? Cool. Okay. Ready? Not yet. There's the blood. There it is. Get in there, that's it. Push in.
And then if you can remember,
Get right in there. You can do this with anything. Bandage, t-shirt, and then 3 minutes, hold as tight as possible, 3 minutes, and bandage.
normal, you're in hospital in 2 hours. We're teaching you not to worry because maybe, you know, with the situation in Ukraine, maybe not in 2 hours, but it's okay. It's better to have them alive than bleed to death. All right, go on, your turn.
Ты же пробовал?
Ну да, там написано.
Давай.
Я вже пробувала,
These ones are hard because you have to do like a with these ones.
сильно занадто, так?
Ні, нормально.
Ні, нормально. Звісно, я неправильно зробила.
So hold it. Put it tight. And do stop. One, like a ratchet. Yeah, once it's tight, now you twist it.
Занадто.
No, you understand.
Молодець.
So you're there. If you can,
You're done.
you can come up, but if not, just that's enough because you're going to be in stress. Right here, look, that's perfect. Now that's
Really was going to be, I mean, I don't want to hurt you, but
with the leg.
it's probably going to have to stay.
You okay?
It's going to be another half 10, I'm afraid. So this is the sort of how much it hurts. Yes, I don't want to hurt you too much. It would have to be
with the leg.
Yeah, so that.
You've got two hands.
That's when it stops.
It's only problematic when you're like, you're in here, this is the tourniquet, you have to do it here. You have to get it on, you have to move it up. And now this is the way, 1, 2, 3 more.
When you practice
That's
with
it.
people, see if you can do it so they lose their...
this one, it doesn't work. 1, 2, bam, good, like a ratchet.
When it does, it stops the artery.
Like the straps on the car, you know? Cool.
Fast. Все поняла? Да, уже через регулятор.
Ну да, понял, ты же побачишься.
Давай, працюй на камеру.
Убери! Родя, ты издеваешься? Ты знаешь, сейчас у меня там еще ничего нет. Ничего.
Turns out my phone didn't survive either. Hello, my name's Ed, this is Matt. Nice to meet you all. Does everyone speak English?
Everyone.
Oh, fantastic, okay. My Ukrainian's not brilliant. So I think you've done the other 2 stations now, so we're going to talk on this one about airway and breathing, and then a bit about circulation. So we know so when people get injured, the first thing that kills you is massive bleeding, and that's why we put a lot of effort into doing the bleeding, so you've got to control tourniquets and that sort of thing. The next commonest thing that kills you is getting a blocked airway. So if it's not bleeding, if you haven't got an airway and you can't get air in and out, then you're going to die within a couple of minutes. So what we're going to try and teach you is how to recognise when somebody has got a blocked airway, and some simple things you can do just to open that airway, which are really, really simple, but which will save someone's life. So how would you recognise if someone's got a blocked airway? What are you going to look for?
Breathing.
Yeah.
No signs of breathing.
Moving.
Yeah. So you can get a couple of different things. You can either get a completely blocked airway, so there's no air going in and out, in which case they're going to be lying there not doing anything at all. Or if you've got a partially blocked airway, so it's a little bit blocked, you can get this kind of gurgly, horrible sound. So both of those are bad. So when you find a patient who's unconscious, how are you going to approach, how are you going to assess that patient? What's the first thing you're going to do? So you've come across that there's been a bomb's gone off, there's someone lying there on the road, unconscious. How are you going to tell if their airway is okay or not?
Checking
Yeah.
if breathing or not. Like lifting the
But
chin.
even before that, I would just go over and say, hello. And if they talk to you, their airway's okay, because they're talking. So if they're not talking to you, then yes, are they breathing? So can you see the chest moving? Is air going in and out? Do they sound really gurgly? And that's probably the key things to look for and listen for. So, okay, let's assume their airway is a bit full of stuff and it's a bit horrible. The first thing you can do is just have a look in the airway and just see if there's anything obvious you can take out. So it might be that they've lost quite a few teeth, or there's lots of blood. You can then just literally go in and just take out anything you can see. So what you don't do is put your finger in all the way down, because that's bad. But if you can see obvious things in there, you can just take out teeth or whatever's in there. What about some simple things you can do to open the airway up? How can you open someone's airway? So they're lying there.
The chin?
Yep. Okay, so you can do what we call, you can tilt the head back and just lift the jaw forward. So you're putting your fingers on the bony bit there, not the soft bit, on the bone bit, just lifting, tilting the head back. And we'll get you to practice on Matt in a second. The other thing, you can do something called a jaw thrust, which is actually even better. So under the corners of the jaw, you can put your 2 fingers and just lift that forward. So you can try it on yourself, it's quite painful. Put your fingers behind there and you just try and lift forward. So you can't really do it on yourself because it's very, very difficult. Matt, do you want to have a lie down? So we'll demonstrate on Matt.
Always have a blanket.
Right. So who would like to demonstrate? Who's going to go first? Come on then. So he's unconscious.
Are you alright?
Right? Okay, so like we are checking if
Yeah, so he's not breathing. No breathing at all. So yeah, so just tilt the head back. Good.
okay.
So that's all you need to do to start with. Is just tilting the head back. And then do you want to try and do a jaw thrust on him? So if you
Show me like this one.
there you go. Alright, fingers under there. Lift up.
So it's easier to approach from the
Yeah, so if you do it from that
back.
side and then just lifting forward, that's it. And you can feel the jaw move.
Okay.
And that just lifts the tongue away from the back of the throat. And you can hear the difference if someone starts breathing, that horrible gurgly noise will go. So yeah, everyone have a go at doing that on Matt. Right, who's next? Go for it. That's good. And just lift forward. Yeah, so just under the corners there. And just lift straight up. That's it. Perfect. Right, anybody else want to have a go? It's worth having a go so you can feel how to do it. It's really simple. It does make a big difference if you've got a blocked airway. That's good. Next up. Yeah, perfect. Right, go for it. Yeah, that's it. So it's really, really easy. Anyone can do that, and it will save someone's life if they're unconscious and not breathing. Anybody else want to have a try? No? All right, good, let you go then.
Thank you very much.
Okay. So, if you've got no kit at all, just doing that will make a difference. The downside, if you're there for 20 minutes, you're going to be there for 20 minutes doing that and your fingers get really tired. So we can use, there's some simple things called oral airways, which you can actually use to do the same thing, and it then frees you up to do other stuff. So these are very lightweight, they're just bits of plastic, and they've got a hole in the middle, and we can put those in. So we're going upside down, and that just pops in, and that then just keeps your tongue away from the back of your throat, and air can go straight down, and that can solve the problem. So there's different sizes. For most kind of adult males, or in orange, adult female is usually a green size. It doesn't matter if you get the wrong size, you can always take it out and put a different one in. Have any of you got these in your medical kits at all? So that's probably something to think about getting, because they're really cheap, and they make a huge difference.
I believe we have a nasal, yeah? Like a nasal tube, yeah?
Yeah, we'll do those in a minute as well. Yeah, so they're good. Okay, that's really good. Right, so we're going to have a go putting this in. Let's start this side, you're going to go first of all. So it's going to be going upside down and then just twisting it around. That's it. Yeah, and that just sits just in front of the teeth then, just like that. No, that's fine. And that then just keeps the tongue away and keeps the airway open. It's that easy.
Is it for the person or is it?
They're going to be unconscious, so yeah, they won't mind. So, if they're...
The second time.
Okay.
Yeah, then twist it around.
Okay.
So, yeah, good. Right. Go for it. That's really good. Cool. Okay. Right. So the only problem with these, if someone isn't completely unconscious, yeah, that's right. And then twist it around. It slides down. Yeah.
The tongue, so the reason why you put it upside down is so that you go so if your tongue like from back, so like
that's right.
it upside down and then rotating it through, you
yeah, that's right. It's just there. That stays. It doesn't go down too far then. Cool.
Can I ask why do we use this? Like, because when do we need to start with CPR, and when do we need to move to this part of?
So this bit is when someone's unconscious, but their heart's still beating. So they've still got a pulse. Their heart's still going. But if they had a bad head injury, they might be really unconscious. And
so the heart is beating but not breathing, really.
Yeah, well, they might be breathing, but they can't. So they might be trying to breathe because the airway's blocked up here. No air's getting in or out.
Will be any other signs like, or the chest is moving very quickly?
Yeah, so you might see the chest moving, but you hear that. You just won't be able to hear any air going in or out. They won't be actually getting air in or getting air out. Or they might sound.
Okay.
This might be someone that's unconscious because they've been hit by a car and they've got a head injury. So this might be the case that there's nothing. Their heart is fine, so you don't need to do CPR. But you need to protect their airway because otherwise they're just out their back.
So the main problem with these is if they're not completely unconscious. If I tried to put that in you now, you wouldn't like it. You'd be so if they start coughing, just take it out. So you've got to be fairly unconscious to tolerate that. So the other thing you mentioned, you see, so these are nasal nose airways. So these just go straight in your nose. So they look horrible. There's a bit of twisting.
You can try on each other in a minute.
But actually, these people tolerate these better than those ones. So these are a bit nicer.
Test COVID, you know.
Yeah. It's like a COVID test. And you can put 2 in, so you can put 1 in each side.
They won't reach the brain, right?
No. No. So again, there was a theory that you could put them into the brain, but that's so you won't do that. It won't happen. But also the airway is more important, so they need an airway. So these are very safe to use. And you can put 2 of those, and you can have 1 of those if you needed to. So.
And then this person wakes up and kills.
But if the priority is getting someone's airway sorted, because if you haven't got an airway, you're going to die within a couple of minutes. And that's why these are really simple things. They do make a huge difference. And there's nothing that the hospital are going to do if they haven't got an airway, because they won't survive to get to hospital. So
but out of these 2, which method is better most?
If they're completely unconscious, then that's good. But you do all 3. So I would do 1, see what they're like, and then if it's still not worked, put that in. And each time you do something, you're going to check to see if it's made a difference. Is it better? If it's better, that's fine.
How will we see that he's better, for example?
It will just sound a lot nicer. So it will sound like normal breathing. You won't get that. So, right, it's definitely worth everyone trying to put these in. Right, let's start with your side. So I would go in. That's good. Yeah, perfect.
Should we put some oil?
Yeah, so if you probably won't have anything with you. If there's lots of blood around, it usually doesn't need anything else because the blood will make it.
In the ears.
Right. Go for it. So,
This way,
so
or?
it doesn't matter too much with this one, so I'd go in, literally pointing almost straight down, and you're pushing. So do a little twisting. That's it. Yeah, that's it. And it's in, and it can stay in for hours, then it can stay in for a long time.
Yeah.
Great. Perfect. Yep, perfect. Okay. Go for it. So just, yeah, a little bit of twisting. That's it. That can just stay in then. It can stay in for ages. So,
And removing same way, like twisting, or we do not remove it?
you won't. I wouldn't remove it unless they wake up or something. But even when people are awake, once it's in, people are quite happy with it in.
Yeah.
Yeah. No, I get a lot of patients who have it in and they wake up and they don't even notice it. Right, maybe we'll have a go on this side. Fantastic. Great. So yeah, just pushing downwards and it will just slide straight in. That's it. Okay. Right. So I think it's worth thinking about, if you are getting some medical kits together, it sounds like you've already got those, so it'd be worth just getting a couple of those in there as well, because they are really cheap. They don't take up any space, they're very lightweight, and they just make it a lot easier. So you can put those in, and you can get, if there's several people who are injured, you can then leave that person and go to somebody else, because you've just sorted out their airway. The other thing we thought we'd show you, which you might see, is this thing. Has anyone seen one of those before? So that's called an eye gel. So it does the same sort of job as this, but this goes in the mouth, so it's designed to fit at the back of the throat. So you've definitely got to be very unconscious for this one. So this just goes in, and that sits in the mouth like that. And so you can breathe through that, or if they're not breathing, you can do the breathing for them. So you can breathe through it as well. So I suspect all your ambulances will carry those because they're very, very common. But they're very simple, so that we teach the police in the UK to put those in, so the police will do it. So they're really easy to use, they just go straight in. So at the end, if you want to have a go with that, you can have a practice with that one. So any questions about airway? It's all really simple. It's just doing the really simple stuff, which does make the big difference. If we talk about breathing, so this is our chest. So it looks like a chest a little bit. So if you get someone that is shot or stabbed, or if someone's been in a bomb explosion and a bomb fragment's gone into the chest, you can get holes in the chest through to the lungs. So the problem if you get a big hole in the chest is that whenever you breathe in, air is getting sucked in the wrong way. So we need to cover up any holes that are there to stop that air getting in. So we can either use these things, which are called chest seals. So again, these are probably worth thinking about. They're very cheap, simple to use. And they're just a packet. You open up, They're very, very sticky. And then you find wherever your hole is, and you just put it over your hole. That seals around it. So that means air can come out, so air can escape from around the lungs, but air can't go back in again. And you can put that on the front, the sides, the back, wherever there's holes, you can put it over the top.
And if there is blood here inside,
it doesn't matter. So, because you can't do much about that. So you can't do anything about bleeding it. There will be blood. There definitely will be some blood, but it's the air that's going to cause the problem. So you just need to stick that over, and that will solve the problem. In hospital, they can fix the bleeding and all the rest of it. If you don't have one of these, you can use anything. So a piece of cloth, anything you've got to hand. Yeah, anything, just put it over the top and sticky tape around the side. So just as long as you're covering up the hole, that's the important bit. Cool. So, yeah.
Will there be any specific signs for us to determine that person has been, the bullet has gone through the chest?
So it's going to be just trying to look at the chest. As you can see, a big hole there, and there's usually lots of air bubbling out of it. There'll be lots of bleeding. It just needs covering up. So it's having a good look. So it's looking at the front, looking at the sides, looking at the back, and you're just looking for any obvious holes. And then you'll see the bubbling with air coming in and out, and you'll see a lot of bleeding around it, and it's just getting something to cover up that hole. So if you just remember, it's the first 5 minutes after this has happened, so we're not trying to do anything, we're not trying to do major surgery, we're just trying to keep that person alive until the ambulance gets there, until they get to hospital. So it's really simple things, covering up holes, opening the airway, and if you do that, you'll save a lot of lives. That makes the big difference. Right, shall we move on and do any more questions?
Do we put the person in the recovery position after this?
Yeah, so if you've got that in and they're breathing, you've covered up the holes, you can just put them into the recovery position. And then
on the other side, not on the injured one, but on the...
Probably doesn't matter too much, to be honest. I wouldn't get too worried about that. Yeah, it won't make a lot of difference. So either side is fine. And you can go off and then check other people if there are other people who are injured. Right, do you want to do your... So we're going to talk a bit about circulation now. So we've done our airway, we've talked about injuries to the chest. So we're going to look at if you get injuries lower down and bleeding from the pelvis, from broken bones.
But there is no fake blood, so you'll be pleased to know
no blood.
Your clothes now and hands are safe. Okay, so you want to gather around this side? So we're going to talk specifically about pelvic fractures. So your pelvis is a sort of a real potential area which, if you break, you can still bleed a lot into it. And though you can't see it, it's just like the bleeding that you may have seen over there when there was blood going everywhere. Okay, so these patients are with pelvic fractures are very prone to sort of deteriorating, becoming very unwell, and probably dying if it's left untreated. Okay, so when the pelvis fractures, as it splits open, it disrupts all the big blood vessels that supply your legs, and it leaves it very unstable. The way to help reduce the bleeding, the way to make it stable, is to splint the pelvis back together again by using a series of pelvic splints. Okay, has anyone seen or anyone use these, or anyone know that they're in your kit? Okay, don't worry, because I'm going to show you the binders, but I'm also going to show you a way of doing it without the binders, so that you can just use it with quite simple bandage techniques. Okay. As I say, what you're trying to do is you're trying to bring this pelvis back in line to help reduce all the bleeding. And you're using any one of these devices. They all work in the same way. They all work by applying a band around the top of your legs, so just on the bony parts of your hips there, and you apply a band round. And you apply some tension to that. So it looks a little bit like that. It's difficult to describe with when I'm clothed. They're very, very noisy. Yeah, exactly. You guys were just as noisy over there. So I'm going to use Ed to demonstrate. So if I could just ask you to clear a bit of space, and Ed is going to lie down there. Most patients that get injured don't have the opportunity to put a blanket down for them and a pillow, but... Okay, so most patients that have this pelvic fracture, they will be because they've been hit by a car, they'll be because they've been crushed, because they've had a fall, because they've been involved in a blast or something like that. That's when we're, or gets run over by a car. So that's when you're considering that a patient might have a pelvic fracture. Sometimes it's obvious, sometimes it's not. If they've got a really obvious fracture, often their legs are quite splayed like that, maybe sort of some slight different in length as well. So the first thing that we need to do is bring their legs together. We need to bring them back into alignment. Now normally, when we apply any of these splints, we need to remove any clothing because it gets in the way. You can keep their underwear on, but we take off trousers. I'm not going to take Ed's trousers off. You will be pleased to know, okay? So we bring the feet together, and then we can just tie that just by using a normal bandage. It doesn't really matter how you tie it. This is the way that we tie it, but as long as you essentially get those feet together, it doesn't matter, okay? That brings the legs into alignment. So the next thing, as I said, is to use one of these binders, and they all work in the same way. They all look slightly different, but they all work in a very similar way. I'm going to show you this one. You have to be careful not to move these patients too much. If you start moving them, then there's the risk that you do further harm to the blood vessels and they're already bleeding. Okay, so we can use we can slide this underneath them, and we can just gently maneuver it up or down. You can start from under the back, and we're sort of looking for our anatomy. So we're going to sort of go around back there. Okay. We can either fold these over or we can cut them. It doesn't really matter. And then we have to have a way of applying tension. Okay? Now, you don't need to make it really, really tight. It's not like putting a tourniquet on. You just need to have it sort of snug. Okay? I'll get you to try with one of those in a bit because you get to feel the tension that you're putting on. It doesn't have to be really, really, really tight. Okay. Now, if you have no binder, then you can just use another triangular bandage. You fold it just once, and then you pass it underneath. He's a very helpful casualty. He lifts his bum up. Most casualties will. Okay. Thank you. You can tie that around, same position, tie that around, and then just like you did with your tourniquets, you can either use a stick or you can use some tough cuts. You can tie that over the top, and then your tension comes from just winding, okay? And again, just enough that's reasonable. It's tight, not too, doesn't have to be too tight. And that's just a very simple way of doing it if you don't have any of these kits available to you, just to bring it back in alignment. Before I get you to have a practice, I will just talk about one other fracture as well, once I've released Ed from this. Thank you. One wonky leg, please, sir. The other fracture that we can bleed from quite significantly is your femurs, your thigh bones. So when these break, the muscles in your legs are very, very strong, so the bone ends end up meeting together and often overlapping, okay, because the muscles are tight and pull them together. That means that bleeding continues, and you can lose quite a lot of blood. Not as much as from the pelvis, but you can still lose quite a lot of blood. This is an X-ray of one of those, so you can see how the bones just overlap. You need to essentially get these straight back into alignment. Okay? And it's very, very simple. It will hurt, but it's simple. And essentially you just pull, and you just pull straight, and you keep pulling, and keep pulling. It will probably crunch a little bit, okay? And then you just bring the leg back into alignment with the good one, okay? Now, the bone might stick through the skin. It might just be a completely closed fracture, but as you pull it straight, if it is protruding through the skin, it will come back out. It will go back into where it is. Same again, just tie those feet off. If you think they've got a pelvic fracture, then you just treat them as you did normally. But if it's just a femur, you can just use that underneath the legs and just tie the knees together there just to stabilise it, okay? Now, there is a particular device that we carry and is quite common in military and ambulance settings, and that's just this one here. Essentially, I won't put it on it, but essentially this just goes alongside. We strap it to there, this sits around the ankle, and then that sits onto there, and then we can just use these straps here just to pull it straight to apply some traction, okay? If anyone particularly wants to go through it, I can go through it afterwards, but I'd be keen for you to have a go at doing the pelvis, which is probably more important. Now, these ones are slightly different in that you have a buckle, thanks Ed, in that you have a buckle, and in that buckle, as you apply tension, it clicks a little bit, okay? You don't have to make it click, but it gives you an idea of the tension, and you can do that while you're all just standing up. There's 3 of them, so one for you, and I'll give you yours in a second. But just put your feet together as you're stood there now. Put these on, and I find the end. And then you can just tighten that up, and you can feel how the tension is on that, okay? If anyone would like to practice with the other one, or just do triangular, Ed will very happily be a victim for you. So if you'd like to take resume position. Anyone want to have a go at it? Yeah, so a little bit lower, generally. We often put them on quite high, so people mistakenly put them on high. So yeah, you want them in a little bit lower. For gents, it's right. Here we go.
Якщо у вас є питання, то можете ставити, я перекладу, якщо щось. Я знаю просто.
Do you want to have a go on it?
Just one question.
Yeah.
If the leg is broken, the leg goes on that. We put tourniquet first and then try to unblock the bone.
If it's bleeding like it was over there, you put a tourniquet on. If it's just a little bit bleedy, then you don't need to put a tourniquet on.
But if it's broken and we need to do like that.
Yeah, that's fine. Yeah, no need for a tourniquet.
No need. Okay.
No. They might, if you have some painkillers, they might want some painkillers. Let's take all the Velcro off. There you go. There's a lot of Velcro on this one. So we can take that one off there. If someone can give you a hand, it's often helpful for someone to give you a hand. There we go, so you can cut these. So so you need their attention there. Okay, so they're like that. And then you can put those like that, that one like that, and then you can just pull back. Okay. So if you pull one side, I'll pull the other. Keep pulling, keep pulling, keep pulling. Okay? Like that. Alright. Don't forget you have to tie his feet together as well. And take his trousers off. If anyone wants to have a go, please have a go on it. He is very happy to be strapped up. Are there any questions at all?
Also, we do it, the bone is completely fractured. Like, you know, it's just not moving, and you see that it's completely, you know, broken.
Yeah.
So what do you know, to stabilize it?
Just bring it in line with the next one. So if
we
you've got
tie
a good leg,
it together?
you can just tie it together, yeah. Okay. If there's...
Супер работает нормально.
Не сильно.
Давай. Yes, yeah.
Yeah. You're tying the feet together is really important.
Are you okay?
Мені починає подобатися. І тут джентл. Я тобі не допомагаю.
You're tickling.
I need you here.
I'm a much better patient.
You are, really. She's not helpful.
No, exactly.
And this one. Here.
And yeah.
Oh,
great.
So yeah, so it feels quite tight.
Yeah.
I say truly.
Exactly.
Yes,
Yeah.
She just needs one of those Airways in now.
Ні, а тут прям добренько, да, прям. Ножки наб'єш?
Great. So I think all the things that you've done in the last 3 stations now, it's all really simple stuff. But it's trying to do it when you're really stressed is really difficult. So it's very different doing it here when it's all nice and sunny and it's all calm. But when there's explosions, gunfire, people screaming, that's when it gets really, that's why it's worth practicing it now, so you know how to do it. So when it happens for real, and it actually is really, your adrenaline's going, your heart's racing, and you're feeling super stressed. If you've practiced it before, and you've got that clear thing in your mind, we're going to control major bleeding, we're going to sort the airway out, we're going to cover any holes in the chest, we're going to splint the pelvis, straighten the leg, and if you can do all that, it'll take 2 or 3 minutes, you can do it really quickly, and then when help arrives, you've done 90% of the job already, and you're giving that person the best chance of surviving. So I'd say it's all super simple, but it's just knowing what to do in what order. Anybody got any questions they want to ask about anything?
Given all this information, it sounds like the first aid kit should be like this, box like this.
Yeah, well actually I think if you take your first aid kit, if you go away from today and you have a look and you think what should we be carrying in our first aid kit, then hopefully some tourniquets, hopefully something where you can pack wounds so you get used to that. Some simple airway things, so just those nasal ones are good, and if that's all you've got, that's great. You can get some of the oral ones as well. probably some of the chest seals, and then a few of the triangular bandages. You don't necessarily need these ones. You can demonstrate that you can just do simple ones like that. But
you can fit most of it into, that's what we carry. So you can fit most of the stuff into there. So you've got your tourniquet, you've got a dressing, your chest seals for covering up holes, and you can put a triangular bandage in there. So you don't need a very big kit.
It's a bandage.
That's a bandage.
That's the big ones that you use to pack over there, the ones that open up.
So yeah, so you don't need very much. Something that size you can just carry with you in your car or wherever you're going, and you just got everything in one place then, it's really simple.
Great.
Right.
I think that's everything. I think, yeah, we are going to finish with a session back inside, but also we're just going to do a quick demonstration using this car in a minute. But if you would like to head back inside just for the time being, grab another coffee or water, and we'll be back shortly. All right?
Thank you very much.